welcome to India Today SoSouth. This is Mandira. In the recent years, Bengaluru has been witnessing a rising trend in male infertility. And this has been sparking a lot of concerns among health experts and couples, especially the ones belonging between the age of 35 to 40. Doctors say that it's a whole combination of factors such as smoking, consumption of alcohol, sedentary lifestyle, radiation exposure, and even delayed parenthood. Keep watching this video as I delve deeper into the causes, effects, and the possible solutions with Dr. Arunima Haldar of Manipal Hospitals in Bangalore. So we have Dr. Arunima Haldar with us. Ma'am, thank you so much for talking with India Today SoSouth.
Thank you.
So to start off, ma'am, can you give us an overview of exactly how the current trend on male infertility is right now in Bangalore?
Okay, so let us first understand how it is worldwide. So male infertility in the last, say, around 50 years or so, the male infertility has declined by around 50 to 60% in the last 4 to 5 decades. So what average we had previously, say in the 1980s, was probably 60 million sperm count at that time. Now it has come down to around 20 million. Right? So, say for example, in a year, around 12 to 18 million couples in India are suffering from infertility. Okay,
right.
And 30% of this are attributed to male infertility. So, if you think Bangalore is a cosmopolitan city, it's a world-class city. If not more, at least it mimics the magnitude of the entire world. So it is approximately that much. The magnitude is approximately that much. So there is a definite decline in the fertility. Say for example, in my OPD, if 10 patients come, 10 couples come for infertility, out of that 5 will have some or the other male factor problem, of which around 1 to 2 will definitely have severe male factor problem. So that is the magnitude of male infertility in the current age.
Okay. So how, in talking about the context of awareness, in your patients, how much is the awareness around male infertility that you think?
So, previously, say for example, 10 years back, we used to have, a couple sitting at our clinic where, the male is probably very confident that he does not have any problem because there is no erectile or ejaculatory dysfunction and the semen looks normal, and we are going on investigating the female. But that's not at all the case now. Now, men, they come up and say, doctor, we are trying for pregnancy and I would want to get evaluated. Or we are trying for pregnancy, I have done my semen analysis, please see if there is something abnormal in it or not. So nowadays men are quite aware that there is a decline in fertility. Of course, there are some areas in the country or some areas in the society where the males are not aware, but especially in the city, definitely they are quite aware now about their health in general.
Right. So what do you think are the causes for this, basically? Main factors, I'm sure there are a lot of, a whole combination of factors that are affecting, can affect to male infertility. Also bringing this up because consumption, I have read that consumption of alcohol, smoking, I have choosing to, for delayed parenthood or because giving importance for careers. So what do you think are the main common causes for this and the factors that affect?
The most important factor in today's date is lifestyle. That's the most important factor. Now, lifestyle has a lot of things in it. Okay, so first I'll go one by one. First, let us talk about overweight or obesity. Okay, so that is the most important or the most common cause of fertility problems nowadays. So, the testicles usually are outside the body. There is a reason for that. The sperm production happens at 2 degrees lower than the normal body temperature. So that's the reason it's in the scrotum. Now, a person who is obese, he has a lot of pelvic fat, right? So that increases the temperature of the scrotum, and as a result, the sperm production decreases. That's one in obesity. Second, an obese person has a lot of peripheral fat. Okay, so you will see that these people have male breasts. These people may have ejaculatory function dysfunction. So why? Because the male hormone is going to the fat and it is getting converted into female hormone or estrone. Now that is the reason they have these problems. So also the sperm count also comes down because there is an abnormality in the male hormone. The third thing, these patients are obese, so there is a pressure downwards. So obese people have varicose veins. Obese people have something called as varicocele. Varicocele is something where there is dilated veins around the testicles. So that increases the temperature of the testicles, and again sperm production is decreased. So wherever there is increased temperature, the sperm production will decrease. Okay, now obesity is also a very highly inflammatory state. Now this is something we need to educate everybody nowadays, that inflammation is something which has come into our bodies completely, and it is affecting your cardiovascular system, it is causing immunological problems, and it is causing infertility as well. It is affecting bone health also. So since obesity is an inflammatory process, it increases the amount of breakdown in the body. So our body is a balance between breakdown and repair. So if the breakdown is more, the repair is not able to cover it. So these sperms may be normal looking, but their DNA inside may be broken, right? So this is another problem. The fifth problem which we usually face with obese people is that they are diabetic. Usually a lot of them could be diabetic. They may not know that they are diabetic. They may be uncontrolled diabetes. So diabetes again, increases the oxidation or the breakdown of things in our body, and the repair work is not enough. So these are the ways how obesity affects. Now the second thing, like you were talking about, is smoking. Now smoking is not only restricted to cigarette smoking. There is marijuana smoking also, a lot of it. So cigarette smoking and marijuana smoking they cause the decline in the sperm quality. Motility. Motility means how fast the sperm is moving. Typically in marijuana smokers, we see that there is tapered sperms. The head of the sperm is abnormal. Okay, so that is one thing which is typically seen in marijuana. The smoking is something which is a big no when you are looking for fertility. And apart from that, of course, alcoholism. In lifestyle, there are many other things. For example, there is something called as endocrine disrupting chemicals.
Okay.
Okay, so these are the things. Say, for example, men put a lot of perfume. The perfume is an endocrine disruptor chemical. Okay. Say they order food from Swiggy and they close that hot food inside the box.
Container,
yeah. And there is something called as bisphenol or BPA, which is released into the food, and that is again an endocrine disruptor. Okay, so what is this endocrine disruptor? Even your pesticides are endocrine disruptors, which are there in the fruits and all. So a lot of things we can change, lot of we can't change. So these endocrine disrupting chemicals, they act on the central system of the, which is there in the body. So what is the central system? There is a brain from which there are two hormones which are being released, the FSH and the LH hormones, which act on the testicles to cause sperm production and testosterone release. Now, these endocrine disruptor damage this axis. So testosterone production decreases as well as sperm production is affected. There have been research saying that this particular compound is decreasing the sperm quality, the sperm motility, the morphology of the sperm. So that's how these affect. Apart from this, there are stress.
Yeah.
Okay. Stress is something, like you were saying, people are, too busy with their work.
Absolutely.
They want their career to move ahead. So they have, they are not sleeping well. They're excessively stressed out in their work. What happens when you are stressed out? There is the release of cortisol hormone. So this hormone is diabetogenic. This hormone can lead to obesity. And again, it can, increase all the oxidative stress in the body, and it can, your DNA may be broken, the sperm DNA may be broken, the sperm may be abnormal in these cases. Then sleep is something I keep telling all my patients. Sleep is very important. It is, like when we were hunter-gatherers, how we used to sleep.
Yeah.
How humans used to sleep. When there is sundowning, they used to go to sleep, right? Why is it important? Because there is a hormone called melatonin, which is released only in the dark. only when your eyes are shut and it is dark outside.
Okay.
So this hormone is important for regulating your not only fertility, various other activities in the body. So ideal would be to go to sleep by around 9:30, 10 and wake up at 5:30, 6. But that is not a possibility, and we have to as much as possible know these, be aware of these and try to incorporate. I know it is difficult in today's date, but as much as you can, you do. At least you could stop scrolling through the social media before you go to sleep, because that has a lot of light which affects the sleep very significantly.
So radiation also plays a big factor.
Yes, radiation also. Say for example, a person is radiation and heat, I will say. Say for example, a person is using a lot of mobile phone. Okay, that mobile phone they will keep in their pockets. So that is again very close to the scrotum. A laptop has a lot of heat in it. They will put on the lap. No, you can't put on the lap. You have to put on the desk and work. And then there is another thing. It is not very proven, but people who wear very tight underwears, they could have abnormal sperm quality. And people who travel a lot, their sitting job. The movement, the blood flow in the testicles is obstructed. So that also could lead to, say for example, somebody is having to travel a lot, especially in Bangalore, so much of traffic. They travel a lot. Okay, they are traveling for 2 hours. So what they have to do is that they have to, at the signal, they probably have to get down and stand, or probably they have to take a break after 30 minutes or so. So that's very important. There are some other causes of infertility. When we talk, say by the book when we go, we can divide the causes of infertility in males in something called as pre-testicular, testicular and post-testicular. I talked about that central the system, the axis, where the brain is releasing the hormones FSH and LH, and those hormones are acting on the testicles, and that is finally able to release the testosterone, and the sperm production is happening from them. Now, all our male infertility is can be assessed by this axis. So if there is a problem at the level of the brain, okay, so which means these patients will usually present by around puberty, and they are not able to develop any secondary sexual characters, or they may present late in early adulthood where they are presenting with infertility. So these usually are a problem at the level of the hormone release, like FSH and LH hormones are not being released properly, and these usually are treated with hormones, and they usually are easy to treat, but difficult to identify many times. Then coming to testicular causes. Testicular causes means the cause is pertinent to the testes only. There is a problem at the level of testes with the sperm production. Okay, so there could have been a trauma to the testes. There could have been an infection which has caused inflammation of the testes, and the testes has healed with fibrosis or scar tissue. That is why it is not able to release enough sperms. There could be some genetic problem which is preventing the testes to produce sperms normally. Again, there could be a problem after the sperm production, which means sperm production is normal, but in the tubes which take the sperm to the ejaculate, those tubes are blocked. This blockage could be congenital, or there could be acquired, like somebody has thought they have finished their family, they have undergone a vasectomy, or there has been an infection of the tubules, so because of which they have got fibrosed or scarred. That is the reason the sperm is not able to reach the ejaculate. So these are the broadly by the book causes of infertility, and we can attribute even the lifestyle causes to one of these.
So we've also mentioned, I mean, we live in a time where we want to take control of our lives. We have a lot of focus on our careers, and which is why there are many people at this age who make choices of delayed parenthood and also delayed childbirth. And do you think age also is a huge factor?
Yeah,
in this?
That's a very important thing, and which you have brought up, because initially we used to think that paternal age is not that significant. Andropause, like you can say, we used to think that it comes at around 50 or 60, and it's safe to go ahead with pregnancy even at advanced paternal age. But nowadays studies are coming which say that the sperm count, the testosterone levels start decreasing by you are around 35 or 40. Okay, and when the father is beyond 45, there is a higher risk of mental issues in the child who is born. So it's very important that you plan. It may not be possible, okay, but wherever possible, you please go ahead and plan a pregnancy earlier.
Okay. So, discussing all of this, as we covered all of this, what do you think? Are there like any standard diagnostic, treatments or testing that men can go ahead, and what is available for them and what is affordable for them?
Okay, so any person who is looking to understand what is their current fertility status, or for example, for any couple who want to go ahead and understand their fertility, whenever we see them first, it's a baseline test to go ahead and do a semen analysis. So what do we see in the semen analysis? We see what is the volume of the semen, what is the pH, what is the specific gravity of the semen. We see the number of sperms which are there. We also see what is the sperm's motility. Motility means how fast the sperm is moving. There are two types of movement. One is progressive motility and one is non-progressive. The progressive motility should be adequate. What does that mean? The sperm is traveling very fast. Why is it required? It has to travel from the vagina to the fallopian tube to fertilize the egg. So it has to travel very fast and very long. So that kind of a movement, which is very important for the sperm, has to be good for a person to be able to be a father. Also, we see morphology. Morphology means what is the shape of the sperm. A sperm is supposed to have a head, a neck, a body and a tail. So are there two heads? Are there two tails? Is an abnormal neck? Something like that. So these are the factors which we see in the semen analysis. So usually this tells us, gives us a very good idea as to what is the status. If, for example, we are suspecting that there is a problem with the some other problem with the person, like for example they have a hormonal cause of infertility, the hormones like FSH and LH that is not being released in a proper way. How will these people present? These will usually present with at an earlier age, probably just after puberty, with abnormal, no secondary sexual characters, no beard, no mustache. So we will be able to identify them early, or they may later on present sometimes with infertility. So we can just give them, few injections for treatment. So for these people, we have to understand how is the hormones. So we have to do hormones like usually FSH, LH, testosterone levels. For some people, we end up doing inhibins. So there are prolactin if somebody is having ejaculatory dysfunction. So these are the hormones, so which are not routinely done, which may be indicated in some people. So and also there are certain other tests to understand if there is any genetic problem which is giving rise to infertility, like we do chromosomal analysis or a bichromosome microdeletion for some people. Sometimes we feel that the testicles itself are smaller and they are not producing enough sperms. In those cases, we go ahead and we can do an ultrasound of the scrotum, or we can go ahead and do some other ultrasound where we identify the complete male reproductive system. We try to image the complete male reproductive system to identify any abnormalities.
So now talking about in the context of IVF, after covering all of the factors and the lifestyle factors which you've also mentioned, talking in terms of the IVF context, we live in a very fast-paced world now. We have a lot of AI and there's a lot of advancements in medical advancements as well. So there is also the role of assisted reproductive technologies, which is IVF and ICSI. How well do you think, in your opinion, would recommend this?
Okay, so we do IVF or ICSI, which is ICSI, intracytoplasmic sperm injection. We do that for male factor as well. So only for male factor we can do it, but it has to be really severe. So how do we go about the treatment? Let me tell you a bit. So if it is a less severe, or it's a mild to moderate male infertility, we can give medications. Medications could be in lines of antioxidants, or they could be minor hormonal medications or injections which will improve the sperm quality depending on how severe is the, but it is usually given for around mild to moderate sperm abnormalities. Broadly speaking, If the sperm count is above 10 million and more or less fine, we can go ahead with something called as IUI. IUI means intrauterine insemination. That is, we take the semen of the husband and we process the semen and put it inside the uterus. So the semen is processed, all the abnormalities from it has been removed. The best, the best activated sperm is put inside the uterus, where it has to travel less to meet the egg. Okay, so that's how we do the IUI. So the minor abnormalities are usually taken care by this. If there is a severe abnormality, what could be a severe abnormality? Severe, deficiency, we call it as severe OATS, oligoasthenoteratozoospermia. The short form for that is OATS. So if it is a severe OATS, severe OATS means that your sperm count is less than 5 million. Okay, in that case, we may need to go ahead with IVF, where we are not allowing the sperm to travel anywhere. We are taking out the eggs by doing an IVF for the wife, and we are keeping the sperm with the eggs. If the sperm count is less than 1 million, then we have to take the individual sperm and put it inside the egg by a micro injection. That is called as ICSI. Okay, so this is how the male factor is usually overcome by IVF and ICSI.
Okay. So ma'am, what do you think are the success rates and what are the challenges the patients usually go through?
Okay, so it's not very easy to treat these patients. Usually, for the development of an embryo, 50% is the sperm, 50% is the egg. So the sperm has a very important role in development of the embryo. So usually if in IVF, what we do first, we inject in a normal IVF, we inject the sperm inside the egg and we let the embryo grow for 3 days, and then we check it again, and then we see on the 5th day as well. So we can transfer an embryo at the day 3 stage or the day 5 stage, either. So when we see the day 3 stage, the day 3 embryo is depending on the maternal genetics. So the day 5 embryo is an independent embryo. It is self-regulating, which means the sperm should be very good for that embryo, the day 3 embryo, to convert to day 5. Not all embryos convert to day 5. In nature, only around 55 to 60% of the embryos only convert to the day 5. Typical challenge in male fertility is the conversion between day 3 to day 5. So when we try to take this embryo to the 5th day, many of them will not come.
Okay.
So that is one problem we face. But once we have attained a day 5 embryo, the success rates are similar to the any other IVF pregnancy, that is say around 55 to 60%.
Okay. So ma'am, of course, talking in terms of male infertility, there's definite impact for a man, their mental health, their relationships, their marriage as well. So there is a social stigma as well surrounding it. So what advice do you give to your patients, to manage their emotional and relational challenges?
Okay, I have usually 2 advice for these people. First and foremost, don't involve the family. It is a struggle, really. Don't involve the family. It's a struggle for you. When the husband or the wife, whoever is having the problem, their parents will be calling them every day with a very genuine interest in their mind. How was the meet with the doctor, and how, did you try today? Even some people go ahead and ask that. And these girls or boys who are trying to get pregnant, they don't really take it in that way. They feel they are being judged. And I have told the parents also, don't involve yourself in their fertility journey. Now, when the baby comes, it's everybody's baby. The baby is going to bring happiness to the entire family. That's a different thing. But this struggle is theirs. And them and the doctor, they will usually be able to manage it. And the second thing which I tell my patients is that be supportive of each other. There is nobody to blame in this. Our previous generation never had this problem. We are having this problem because of whatever happened, changes happened in the last few years, last few decades. That is the reason our generation is suffering. Okay, it could be the environmental pollution, it could be all the EDCs which I have talked about. Nobody knew about all these things, right? So there's nobody to blame. on this. So it's very important that don't blame each other, be supportive. Life has to move on even with or without a kid, right?
Absolutely.
You are here for another purpose. You are here, you have to find your purpose. The happening of a kid has to go on the side. It has to go with your work. Your life should not stop because of this. These are the two advice I usually give my patients who are, majority of them have a lot of mental problems, a lot of marital discord, and which gets, as many of them actually become closer to each other as they go ahead in this journey, whether the result is good or not.
Okay. That's lovely. So, ma'am, what is one practical advice you would give, and certain resources that you would suggest to people having or facing infertility issues?
Practical advice is DESS. That is your lifestyle changes. Diet, exercise, stress, sleep. These are the four-pronged approach to improve your fertility, your general health as such. Diet every meal should involve the 4 pillars. What are the 4 pillars? Carbohydrate, protein, your fat, good fat, and fiber. Right. So these 4 should be there in every meal, even for you, even for me, even for anybody. These are the 4 things should be there, and this is these are the macronutrients, and they have to be balanced. So what sometimes we eat just 2 toast, no? So that is not good. A toast and an egg is a complete food. Understood? So that's what you have to pay attention to when you are eating. When they should, they should include some fruits in their diet. Whatever seasonal fruit, you don't have to have kiwi or dragon fruit. You can just have banana or whatever available in the banana is something again which increases the glycemic index. So it's good for people who exercise. Now coming to exercise, any form of exercise is good. You just have to be active. Right. When you exercise, it doesn't mean I have done 1 hour of exercise, now the whole day I can sit on the bed. No, you have to be active as well. Your exercise should include resistance training as well. That doesn't mean weight training. You don't have to go to the gym. You can go swimming, you can do floor exercises, but resistance training, building muscles is very important. Yeah. Okay. Then coming to sleep, there is something called a sleep hygiene. What is sleep hygiene? Now people should, in an ideal world, okay, utopia. In that world, people, should finish dinner by around 7. They should not be taking any caffeine after 5 p.m. Okay, they should not touch their phones from around 8 p.m. and they should go to sleep by around 10:30 p.m. Wake up at around 5:30. It may not be possible for everybody, but whatever you can do for yourself, please do that. Okay, stress is again something which has to be really identified. A person who is in a stress, they will not be able to identify that they are stressed out. So it has to be identified at least by you or your spouse or whoever is living with you, and it has to be tackled, because stress is something which definitely increases infertility.
Okay.
Okay. So DESS. This is my dictum for everybody. Okay, and resources, as you were saying, the best resource is your doctor. So please do not go and blindly see Google, because it really scares you. There are a lot of things which are there which
it's exposed to too much information.
It's too much information and unnecessary. Every headache is not a brain tumor, right? So understood. Every fertility problem is not an IVF. Understood. So that has to be taken care of. So you can meet the doctor who will give you the correct information as to what is the requirement. There are certain government sources, say the Indian Fertility Society or the Indian Society of Assisted Reproduction. They will let out some patient knowledge facts or something like that, which in their site you can go and read up on them. Or there are international guidelines also, like the UK guidelines or the American guidelines, where they give guidelines about from the patient point of view. Okay, so you can go ahead and the patient FAQs, you can go ahead and read them. So that will be very helpful. So, but definitely your doctor will give you a much individualized approach.
Right, correct. Okay. Alright, thank you so much for talking to us, ma'am. Thank you for your time. Thank you for watching this video to better understand male infertility. We hope we shed some light and awareness on the causes, effects, and the emotional impact of this issue. If you found this video informative, make sure you like, share, and comment, and subscribe to our channel. With cameraman Sanjay Panappa, this is Mandira for India Today SoSouth.